I want to bring up a dear friend of mine and a family. I want to bring up Mr. Steve Smelski to really talk about the Jordan story. And it's a heartfelt story, and I appreciate their efforts for driving this. We wouldn't be here for their commitment in order to make public health messaging and alert the greater community. And they took the time to come here today, and for all their efforts across the nation to ensure that we alert other communities around the nation. And so to me, that is very critical. And for them to take this as their mission and establish a foundation, I'm indebted to them. And we, the public health community and the healthcare community, owe a lot of kudos to that. Thank you. So let's give them a hand.
Good morning. My name is Steve Smelski. I'm Jordan's dad. Normally I would say Jordan was my son, but we've had a lot of people say how special he was, and so I'll just say I'm Jordan's dad. And Shelley and I would like to thank everybody for coming today. We'd also like to thank Florida Hospital, Dr. Rajwat Howan, for helping get this set up, and Dr. Jett for making it a reality and being able to stream it. Jordan, let's see if I've got it. While they key it up, Jordan was our only son. He passed away last year on July 2nd, 2014. Jordan was 11 years old. He graduated from Seminole Elementary School, Wilson Elementary in Seminole County. And we always took a vacation during the summer, and we tried to make it special every year. Jordan was well-traveled, and we asked him where he wanted to go. And he asked if we could go back to Costa Rica. We'd been there in 2011. So we went ahead and, see if I've got the slides ready yet. He had asked us if we could go to Costa Rica. We went back, pretty much did the same trip that we had the year before, or 3 years prior. And we did the same things. We did zip lining, rode horses, and we also swam in the hot springs at the resort. And we'd been there 3 years before. Now, we knew about Naegleria and the threat here in Florida because there have been several boys a few years ago that lost their lives here in Central Florida. So we're very, very aware of it. We live on a lake. Jordan wasn't allowed to swim in the water, wasn't allowed to go in the lake because we knew it was there. But we didn't know about hot springs. And we went back to the same resort that we'd been to 3 years prior. And he and I spent 6 hours in that hot spring. And that hot spring had a water slide. And I bet he went down that slide 200 times. The problem was you couldn't go down the slide without getting the water up your nose. And Jordan came home, had a headache. I didn't get one. And we swam on a Tuesday. Do we have them? We had the flight coming home on Friday. So 3 days after we swam in the water, Jordan complained of a headache. We got home. He wanted takeout. He wanted some American food again. So we stopped and got it. He got up on Saturday. He seemed okay. And by Saturday afternoon, he was starting to get sluggish. He was laying around. He didn't really want to do anything. We watched a movie that night after dinner, and then he went to bed, and he started vomiting that night. He was up all night. Shelley and I took turns with him that evening, and we agreed, since we'd been out of country, that if he was the same way the next morning, we were going to take him to the emergency room. He was still vomiting in the morning, so we rushed him to the hospital in the morning. We got there about 11. We did a spinal tap and a CT scan, and they admitted him. They thought it was viral meningitis, and that was Sunday evening. He seemed okay on Monday. He was still vomiting. He couldn't keep anything down. He couldn't drink any liquids, and the hallucinations started about 9 p.m. on Monday evening. and they lasted 4.5 hours. And they went from him seeing things crawling on the wall to body twitching, he couldn't control it. By the end of the 4.5 hours, he didn't know who we were, he didn't know who he was, and he didn't know where he was. They brought in the medical staff for the ICU team. Thankfully, they got there just before he had a seizure. And Jordan never regained consciousness after that, 4.5 hours of hallucinations. He hung on for a couple days, and he finally passed away on Wednesday morning, 7 days and 12 hours after swimming in the hot spring. This amoeba works very fast, and it's unforgiving. If you get it, you most likely won't survive it. And that's why we're here today, asking for your help. That's why we've invited some of the speakers in to share their knowledge, is we want to change that. We want to make sure that more people survive it. The press will sensationalize it and call it very rare. And I guess it is, unless it's your child. And then if it's your child, it's not very rare. And all they are is a couple 4-letter words to you. They say it's 99% fatal, yet it's still 100% preventable. So whatever we do going forward has to include awareness. We have to make people aware that it's out there and make sure they don't put themselves in a situation where they're not at risk. We also need a drug that can fight it. It needs to work very quickly. So we need the medical staff to be aware that it could be an option. And I'd like to thank Florida Hospital for being one of the first to change the care pathway to actually check to see if people had freshwater exposure. Those are the type of things that we need help from you as the medical teams to change. And that's the only way that we're going to make more people survive this. I guess we didn't have our slides loaded. Still don't have it up. We've asked everybody to come today to share their knowledge, and we want everybody to take something away today, and we're hoping today is not just a one-time thing. This needs to be a beginning, because we need to change this nationally. It's a worldwide issue. Last year, 14 people died in Pakistan. That was from one hospital in Pakistan, just one. This year, 9 people have died in that same hospital. That's just one hospital in Pakistan. Now, Jordan has the distinct label of being the only known fatality from PAM in Costa Rican history. That's just the ones that we know about. So what we need to change is how this is looked at, and that it's not rare. We need to realize that when you go to a resort out of country, you could be putting your kids at risk. If it happened to Shelley and I, it could happen to any of you. So what we're asking is for your help to try and change it, to make people knowledgeable. When you go out of country and you go to a 5-star resort, you may not be safe. We knew about Naglaria, we didn't know it was in the hot springs. So that's part of the reason we started our foundation, was we figured if we didn't know about it, how many other people didn't know about it? And it's amazing how many people we've talked to, doctors included, who didn't know it was in hot springs. So what we want to do is work with the experts, which are you, and help change the way we face this. Now, what do we need to do? There's a few things we need to do. We need to change the rare label, because if you think it's rare and you're never going to see it in your career, in your lifetime, you won't be ready for the first time it comes into your hospital. So we need to change the label of being very rare. People need to realize this could come in every day. So I don't know if you've been reading the news lately, but there's been 3 cases in Houston in the last month. So the people who thought they'd never see it in their career, guess what? It's there. When Dr. Jett put up the map of the US, which showed the different states with the different cases, there are only 18 states that it's reportable today. We need to change that. It needs to be a reportable disease in all the rest of them. So they say, well, there's only been 132 cases since 1962 to 2014. Well, it's actually 140 now, but those are only in 18 states. How many happen in the other states? If it can happen in Minnesota, It can happen in any state in the US, maybe outside of Alaska, but that doesn't mean it's only 140 cases. It just means those are the ones we know about. So what we need to realize is this may be a lot more prevalent than we think. And if they can have 23 cases in Pakistan out of one city and one hospital, guess what? It's a much bigger problem globally. This is what we need to change. So there are a couple other things that we need to do. Because this is so fast acting, Jordan died in 7.5 days. What we need to do is have a drug that can stop it quick. So when we first suspect it, first we need to consider that it could be PAM when they come into the emergency room. Okay, if we consider that they've been in warm, fresh water, we need to start a drug treatment, which means the drug needs to be local in the hospital. We can't wait 12 to 18 hours. Jordan had 4.5 hours of hallucinations. Once the hallucinations were done, he was gone. So you only have a short period of time to get the drug to the patient when it's needed the most. We've had some survivors. What we need to do is see that number go up. What I want to do is bring it from 99% fatal down to, I don't know, what number can we go to? Let's see how far we can take it. In Pakistan, it's 100% fatal. They have not saved one patient in Pakistan. We need to help with the treatment here. Let's start it in the US. Let's change the world from here, and let's see what we can do to help the rest of them. So we need the drug local. We need a fast-acting drug. There's a couple other things that we need to do. I'm trying to think. I had my list. It was on my slide. Awesome. Thank you. So I'll go back. This is the Tico Times. This is what they reported. They ran a story. It's still on the Tico Times website. This is where we swam. This was in a pool. This wasn't a natural hot spring. So Jordan and I swam in this pool, and you can see in the very back, that's the water slide we went down. He went down that 200 times, and that water splashed up his nose every single time he went down it. I went down at 40 or 50, and I didn't get it. I would give anything to trade places with him. Here's the timeline of what happened. We swam on a Tuesday. He was admitted to the hospital on a Sunday, on the 29th of June of last year. Hallucinations started on Monday. Tuesday, he was in ICU, and he was gone Wednesday morning by 6:35 a.m. 7 days and 12 hours after we swam. That's how fast it is. And it doesn't look like what you think it should, so that's why we need to be looking for it. Here's the things that I had to change. We need to make it a nationally reportable disease. Those other states that had no cases, it's only because it doesn't have to be reported. We need to change that. We need more research. So I know we're looking for a drug right now, but there's more we don't know about Naegleria than we do know. So we don't know why Jordan got it and 80 other people that day didn't. We don't know why 5 can swim in a lake, 1 gets it, the others don't. We don't know why. So there's more research that needs to be done. We also need a continuing education program and awareness for parents. So we need it for the medical community, and we also need it for the parents, because even if we get a drug, you don't want your child to go through that. What we need to do is make sure that they never come in because of it. So we still have to do continuing education on that. This was the message I had on very rare. 99% fatal is 100% preventable. Now, you're going to hear from a couple other parents today. Jeremy Lewis is here. He's going to talk about his son, Kyle. We have Sandra Gumpf. She's going to talk about her son, Philip. So if it's very rare, you have 3 families represented here today. We've been in touch with Michael Lyle's mother from Houston, Cassandra. She wanted to be here today, and she was unable to make it. So that could have been 4 families. He was the most recent case in Houston. Parents need your help. And all the parents who have gone through this are asking, please help us with this. This needs to come from your side to start to change, but we can change the treatment of this worldwide. So thank you for coming, and I look forward to continuing on to the next year.